All right, well, it's just about 2:30, so we'll get started. And certainly if more people join us, they're welcome to jump in. Just so you all are aware, this meeting is being recorded and it is also being live streamed on YouTube to ensure transparency and accessibility of all of the information for this grant application. I'm going to just very quickly share my screen and go over the key deadlines for this grant application again, and then we'll jump right into questions. You are welcome to raise your hand, and then we can call on you to and ask your question, or if you want to put it in the chat box, you can do that as well. Okay, I'll share my screen. Sorry, it's a little bit different with the PDF than a PowerPoint presentation. Okay, so this is the question and answer number one. Winnebago County Mental Health Board program year 2022 to 2023 grant cycle. The specific dates for that program year are June 1st, 2022 through the end of May 2023. The critical key deadlines here are shown on this timeline. The grant application opened December 1st. There is a recorded grant seekers meeting on YouTube, which gives some very detailed information about the grant application process, the key critical documents like the strategic plan, all of the funding resources that should be referenced when writing this grant. December 9th, that's today, that's right now, we are having a grant question and answer session. There will be another one on December 17th. There is pre-registration information, registration information on the website. I'll show the link to that in just a minute. And the grant application closes January 31st, 2022 at 5:00 p.m. Central Time. That is a hard deadline. Please get your applications in before that. That is a Monday. If you can get it in Friday, do that. Don't torture yourself and wait till the last minute on Monday and have a hard weekend. April 6th will be anticipated board funding decisions. So in between that January 31st date and April 6th, there will be a review process taking place. And then, as mentioned earlier, the program year actually begins June 1st. So between April 6th and June 1st, there'll be a period of time in which any work plans, budgets, and funding agreements will be finalized with the funded agencies. Here is the most important link for this process, other than the grant portal itself, is the funding resources page. All of the important documents to reference are on this page, and you'll be able to find them there for easy access, so that you can make sure you have the best information you need for this. And then lastly is the convening organizations for collaboration. I really encourage you to take a look at this part of the funding resources page for two reasons, or for two ways to use this. Number one is you can yourself as an organization go sign up on the organization collaboration interest sign up. If you click that link, you will be able to sign up and make it known that your organization wants to collaborate with other organizations on an application, and you can make it known what particular focus area or target population you're interested in working with. The second way to use that is to check and see what other organizations have signed up and to contact them so you can collaborate with them. That bottom button, organization collaboration interest list, is a list that is automatically updated anytime someone signs up. So when you go and click on it, you're going to see the most recent version of who signed up, demonstrating interest to collaborate. And I would also encourage you maybe to click that top button and watch that video especially if you want more information about the priority areas. That we went into a lot of detail on the priority areas on that particular video. So that video and the grant seekers meeting are two additional really critical resources that are on our YouTube page to give you additional information. With all of that being said, I won't go through the whole presentation again. I would like to make sure we have time for everyone here to ask their questions. We will have another question and answer session as mentioned. We will take all of the questions from these two sessions and we will also update them on a document that we'll add to the funding resource page so that it's easy access to understand what those questions are. And then if people have questions that get answered after the sessions, you can, like if you had a question and it was December 24th, you're thinking about your grant application on Christmas Eve as you listen to Christmas music, and you send a question to info@mentalhealth.wincoil.us and we answer it, then we can also update those questions on the sheet, the reference guide that we'll publish. Okay, so let's see, do we have any questions? I see none in the chat, so don't be shy, just unmute your microphone and go ahead and ask.
I'll ask a question. Oh, sorry, Joan.
No, go ahead, Sarah. I'll go after. Thanks.
I assume I know the answer to this, but for many of us, it took a while to get our programs off the ground and hire people and essentially start spending money. Is it going to look bad or negative if we have unused funds? I mean, not that we've received yet, but unused funds from this grant cycle going into the next one. I know there's some grants that if you don't spend everything, then it's kind of a ding against you. Is that the case here?
I think it's more about how you articulate what your plan for the future is and what you learned from your first year. So one thing that you could say is that what we learned is that it took us 4 months to hire our staff person. And so we were under budget in those first 4 months, but then once we got up and going, we were at budget. And so we anticipate that our budget would be at that amount moving forward. Another thing that maybe you would learn that would be different would be to say, what we learned is that it actually doesn't take as many staff as we thought to meet the demand that we have. So we're going to reduce our budget by a certain percentage for moving forward. Instead of 5 staff, we think we can do it with 3 staff. So it's really about what you learned from it and how you articulate that and how you project that will, what that information means for your budget moving forward. I think that's the most critical part of it.
Okay, thank you.
Can I add to that? Sorry. I would also draw your attention to the final section of the application rubric, which is available. It's linked both in the application and on the funding resources page. So that will sort of dictate the bullet points of what the reviewers will be looking at in terms of your past compliance, both for outcomes and for finances. And so if, you know, the things on there are what they're focusing on.
All right, who else?
Okay, this is Joan Lodge. I'll go. So with this current year's funding, which was for Rosecrans Access to Care, what we would like to potentially consider for the next round of proposals is not really so much changing our outcomes or what our proposal looks like. However, because some of these positions with this current funding was more community access and care navigators. So what we're thinking about for next year with this collaboration piece is connecting with other organizations and having kind of like a memorandum of understanding of how to just coordinate care for individuals that they might be serving in their agencies that are outside of their scope. So I guess my question is, does that require a brand new proposal, or can we just upload additional MOUs, or I'm looking for some direction.
Here's the critical points for the decision about a new proposal versus a renewal proposal. we expect continuous improvement in each of the renewal proposals. So making changes within that is not a problem. If you are adding a new priority area to it, a new target population, or your budget is going to increase more than 5%, then you need to make a decision about either making components of that application a new proposal or doing an entirely new proposal. The reason for that is to ensure that there's fairness in decision making, so that anything that didn't go through the vetting process was pretty strong the first time through, right? Like a lot of took several hours in some cases for board members to review and read those applications, and many conversations happen. The renewal process, while we'll still have a strong vetting process, there's less information required on the renewal application. So for a new priority area, it's important that go through the same vetting process as a new organization who's applying for funding. So I think if you're saying the priority areas are going to stay the same, the budget's going to stay within that limit, and there's no new target populations, the target population is the same, but you're now recognizing that it would be beneficial for you to partner with another organization and that they need to have some funding so that they can participate in that. As long as it's within that scope, those three things, then that's acceptable as a renewal application and not necessarily just a new application. Kristen, you kind of the one that designed the application, so please add to that if you feel there's any additional nuance to that. Okay, very good. Does that answer your question, Joan?
I'm pretty confident it does. I would imagine that we would just want to make sure that we uploaded some of those memorandums of understanding just to show that those were in place.
Yes. So, and let's talk about collaboration briefly. There's different types of collaboration. One type of collaboration might be we're going to provide a service at a location to make sure that our services are integrated with another system. I'm just going to throw out an example without inferring what anybody's doing. We're going to go provide our services directly at a primary care office, but they don't need money. They're good. They're doing fee for service. We're just going to go there and we're going to better connect with her. So that's one type of collaboration. And so for that, you might have a very simple letter of support that establishes, yes, we're willing to have this organization come to our location and provide services. And in another case, you might want a more formal memorandum of understanding, particularly if you're going to have that other organization as a funded partner on your application. They will be receiving money to ensure that, again, that they understand what their reporting requirements are and that they will meet all of the criteria of the mental health board. Now, it is the responsibility of the lead organization to make sure that there's reporting compliance. The lead organization maintains source documents. The lead organization needs to make sure that those performance reports are submitted and that any invoices or any evidence of expenses are submitted. So I would just keep that in mind as well if you're developing memorandums of understanding to probably dictate those conditions within them.
Hi, my name's Christina. I'm with NAMI Northern Illinois. I had asked a question via email regarding indirect costs and how that is calculated. I wasn't sure if an answer had been arrived at yet, but basically just what I'm looking for is this is our first time writing a grant. And so we just want a little clarification on how we calculate indirect costs and how you'd like to see that reported out.
Thank you, Christina. I am still double checking to answer that question, and I will answer it in a way that everybody gets the same information. I just want to make sure because the Mental Health Board updated their funding policy for the next funding year. So I want to make sure that any of those changes that I'm accurately communicating how that might impact the indirect rate. I will say though, just that and more generally, whether you're taking de minimis or you have a cost or you're taking a rate based on a federally or state approved indirect rate plan, if your organization has a cost allocation or plan or policy where it dictates how you do indirect rate, then you need to abide by that policy that you already have in place. And so that's what we've honored. If you currently don't have one and you're just taking de minimis, that's where I wanted to clarify.
And that
If there are any line items specifically that are restricted from being restricted from taking the indirect rate on.
Okay, and just as a follow-up question, it is mentioned on the application that, you know, we're to follow our institution's capitalization policy when we're listing the direct costs. Now, we as a small nonprofit don't have a capitalization policy, and our accountant, I reached out to him to see, you know, if that would be something that would be in our best interest to create. And he said that since we're on a cash accrual basis, that he generally doesn't recommend it. Is that something that is absolutely necessary for having a successful grant application?
Well, I mean, I guess it would be, if you're not asking for capital expenses, then it's completely irrelevant. If
We
you're
would
asking,
be asking for some.
if you're asking for capital expenses, it just kind of depends on the nature of the capital expense, if it's going to be an asset for the organization or not. Because, you know, I guess the critical determining factor is if you purchase an asset and then you're not funded into a next year and you still own that asset, then, you know, essentially that could be income for you in a future year. So that's where the capitalization policy is kind of important for large capital expenses, especially where if it's going to have a significant value even after the program year, kind of acknowledging what would happen to that remaining value should the program not be renewed for another year. So if you need more details on that, you know, that might be one too that we could talk through based on the specifics of what you're asking for to best address. But I think, you know,
I think
you
that
might want to come up with something with your board to adjust how you would do that. The mental health board can also, you know, create special conditions within the funded programs. And I think every current funded program does have at least one special condition. So, you know, I think, you know, that's something that could also be addressed in a special condition. So I would just describe to the best of your ability what your current policies are and how the board handles capital expenses in terms of, is it all showing up in your accounting in the month that it's incurred, or does it get capitalized over time? Any other questions? Some technical ones today. All right. Oh, sorry. There was one question in the chat, and it was about if programs that were not funded last year were not funded, would they need to change the scope of the project? And I think that for the most part kind of depends on what the feedback was. I know because there were only 4 of the top 6 priorities funded last year, there were programs that were not funded on the basis of it seeming like they would better fit under one of this year's priorities, like client identification and outreach, for example. Or for that matter, some of the programs that were partially funded, there were line items that were taken out to say, hey, that's actually something that would fit better under client identification, outreach, or housing assistance next year, but that's not one of our current priorities. No, I somehow got muted, so I apologize for that. I would look at that feedback from last year and really reflect on what it was. And if it just simply was, it fits under a different priority, then I wouldn't necessarily say that you have to change the scope, but definitely look at the updates to the strategic plan, watch the grant seekers meeting, and I would I think those resources are going to be the best for you to make the most competitive application possible. Let me just add to that, as I'm processing that, you do need to file a new application though, not a renewal application, if you were not funded last year. Any other questions? Okay, well, again, there's going to be another one on December 17th. So you'll probably have like, 3/4 of your applications done by then and be just finishing it up, coming with your final questions. But again, you're welcome to always email us. The email is in the chat link here, and we're happy to take questions that way as well. Thank you so much for your time today, and happy grant writing.
Thank you. Have a good day.